This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
I'm MaryAnne Sterling. Thank you for joining us today. This episode is focused on the challenges faced by families with special needs children who are transitioning from pediatric to adult health care. So buckle in, you're going to learn a lot today. I'm joined by two phenomenal fathers of young adults with special needs, and they're going to educate us on this issue. In fact, both of their kids have just turned 21. Jeff Cousins works for a major health system, and Vic Sharma from tech startup MiraKare. Their personal stories are incredibly inspiring. Welcome to you both. And Jeff, I'm going to start with you. Give us a peek at your family's journey.
Well, thank you very much, MaryAnne, for having me here today. It's a pleasure to be here with you. Boy, it's been a long journey. I never would have believed that we would be at year 21 coming up here in August. And it's been a situation where I had a son who was never supposed to survive pregnancy. And he did. And it was, first it was he would last maybe a few hours, a few days, a few weeks. And then now it's like everybody's just kind of crediting the work that my wife and I have put in to our son's life for getting him where he is today. His name is JP, stands for John Page. He is an amazing kid, nonverbal, doesn't walk, but can clearly communicate, read everybody in the room, and turn them into his servants, you might say. We have faced incredible obstacles moving forward with him and always conquered them. And now we're facing this huge obstacle with transition from pediatric to adult care. And that's what I'm here to talk about today.
Well, nice to meet everyone. Thank you, MaryAnne, for really this timely topic here and very important topic that we need to be talking about. Right, I call it the 800-pound gorilla in the room. Jeff, I look forward to meeting JP someday in the near future. Extraordinary young man. My older daughter Mira, has cerebral palsy, which is a motor disorder. And due to her motoric challenges, she really depends on her caregiving village. And I call it a village because it takes more than one person to take care of, even when you have a able-bodied child, right? But ours is differently abled, and my wife and I are the primary caregivers. But we have a wonderful group of caregivers we work with. Being a caregiver, I would say, for someone who is medically involved, right, means that you have to be agile, you have to be flexible and adaptable, sorry, because things can change at a moment's notice, and they, more often than not, they do. I guess when I think of this caregiving journey that we've been on for 21 years now, and Jeff, I couldn't agree more. The time has just gone so fast, right? I can't believe it's been 21 years already. But I would say, my advice to caregivers, and we're going to obviously get a lot deeper into this topic, is the importance of not burning out, right? It is a marathon. It's a journey. As rewarding as caregiving has been for us, it is hard, it is stressful, and sometimes it's a bit lonely.
Thanks, Vic. So the first question I'm going to pose to you is, how is the care that your child receives in an adult setting different from what he or she received in a pediatric setting? Because I'm curious about this, and this seems to be a huge issue right now.
Coming from the health care side of it and seeing that daily, it is a different world in the pediatric hospital as opposed to the adult hospital. The pediatric world is set up because we all know that children can't make their decisions on their own. So the care teams in a pediatric hospital have to embrace not only the patient, but their legally authorized care provider, which is usually their parent or guardian. In order for that to happen, there has to be that constant communication. So it's drilled into every staff member's mind that, yeah, the child may say they don't want to do physical therapy, let's say. But if the parent says that they're going to do physical therapy, that's the person who's going to make that decision. Whereas in the adult world, it's basically 9 times out of 10 communication between the patient and the care provider to that patient, and they make the decision. So it's always been set up to where there's that more robust communication, I believe, between the family, the patient, and the care provider in the children's hospital. And I think that just lends itself to being a better environment because there is that robust communication, like I said before. In the adult world, it seems like there's not that extra element of just that's always there of just the warmth, desire for everyone to work together that you see in the children's hospital. And I think that also goes into having extra things like child life for the patients and music therapy and art therapy and just everybody's trying to make it the best environment it can be, where unfortunately a lot of times in the adult world that doesn't happen.
Yeah, Jeff. I mean, I think, the adult world compare and contrast just the setting, the physical setting itself, right? Pediatric versus adult. Pediatric, you have music, nurses, doctors, they're wearing funny little things on them, right? Just to engage the kids. I'm just kind of throwing things out there that we've seen. And, when you go to adult section of the hospital, it's just very different, can be very sterile at times, right? I mean, we're just transitioning from pediatric to adult care. So we're still processing a lot of this information ourselves, right? But one of the things that's happened now is that all the pediatric doctors that we had, right, some of them who we've had relationships that go back 20 plus years can no longer see her because of their practices, their practice policies, right? And so that's a major change for us. And that also applies to her therapist as well, physical therapist, occupational therapist, speech therapist. So, we're transitioning now then from the pediatric to the adult, and it's a very, very different world. And it's hard, and like I said, we're trying to figure it out day by day.
Yeah, Vic, I mean, we're just right behind you. Like I said, my son this summer turns 21, and we are in the midst of all of those changes and trying to find adult specialists who will take on our son as a patient. And we literally walked into a room with him a couple months ago trying to get an adult specialist. And the adult specialist walked into the room, saw him in his wheelchair, and said, "I don't treat these kinds of patients," turned around and left. And it was like, did this just happen? I mean, but it happens because they don't want to take on these complex patients because they take a long time to see and make decisions and go through their history and make orders. And there's probably more paperwork involved because, like you said, it takes a village to take care of these kids. My son has a nurse at home, so we have home health care, so orders have to be written whenever a medicine change is made for home health care. And I think it just makes a lot of these adult specialists nervous about if they're going to be able to meet their quotas on the number of patients they see a day for their practice to take them on. So a lot of times you have to search and find someone who is willing to deal with these diagnoses that our kids have that aren't typically seen by adult care providers.
Jeff, what you just said right now, first of all, I'm sorry to hear that. That's just a little disheartening. I think that's where I think having that community, having that network, that trusted network that you can go to say, who's out there has had a positive experience with this specific doctor or practice, and then finding those people, they're there. I can show you a very quick story of that where we switched from dental practices a while back. The care that we're receiving now, and this practice, they're actually seeking kids with special needs or young adults with special needs, right? So they're out there, the doctors, therapists who are seeking the special cases because that's what practicing medicine is all about, right? And giving care to everyone.
Luckily, we have been able to find those people, find all the specialists we need now, but it was a lot of work. And, I just think, like you said, I think there could be easier ways to get that done, better roadmaps for us in the future.
Let me ask you guys this. What happens in the real world today when your child needs to visit the ER or is hospitalized for any reason? What is happening today?
Well, I guess fortunately in one sense, I don't know, because the last time my son had to go to the ER, he was still eligible to go to the pediatric ER. Today, I don't know where we would end up. We're working on that in the health system that I work for. We are launching a task force to try to come up with some policies and stuff for these, what we call adult kids, that still are basically kids. And when we say that, it might confuse some of the people in the audience, but we're talking about patients like my son who are chronologically going to be 21 years old. But if you ever look at him, you would never believe he was 21. You would say he was 12, 13, something like that. He's 80 pounds, he's probably 5 feet tall, maybe not even quite that. But you're looking at patients that do not present as an adult, yet they're being put and admitted into adult hospitals. So when these patients come up, and it's not just my son, because I've had several families I've worked with in our health system, the adult units are not ready for this. They don't have the supplies for this size patient. They don't have the diapers. They don't have the catheters. They don't have the blood pressure cuffs for a child. And they typically will say, we need to call pediatrics to get everything we need to take care of this patient, but yet they can't be admitted to pediatrics because they're 21 years old. So you're running into this catch-22 that not only is inconvenient, but does come with safety risks, because in the adult world, patients are treated with adult doses of medication. But if you give an 80-pound 21-year-old an adult dose of medicine, that could be risky. That could cause problems and end up, having to fill out risk event reports and things like that. So it is something that is desperately needed to be dealt with. And it's only becoming a problem because these children that we talk about never used to live this long. But because our medical technology and our advances have been made, we are just now starting to see this issue become more relevant. So going back to the question, I don't know where my son would go at this point. He did have one instance when he came before he was 21, of course. He did go to the ER once and got admitted to the adult ER because the peds ER was filled with younger patients. And that actually ended up being a good experience because in that sense, the adult team saw his respiratory issues as more chronic and was waited to do a blood gas test on him before they put him on a ventilator. And when they did the blood gas test, it showed that his blood oxygen level was higher than what the monitor was telling them. So they were like, we're okay, we can work on this before we go intubate. But they looked at me and they said, if he had gotten admitted to the peds ER, he would have probably been intubated because they don't look at those kind of things in the peds world. So there are reasons for both, it just, everybody has to be ready for the type of patient they're going to get and knowledgeable about what these types of patients need.
Yeah, well, I guess, we actually ended up going to the ER after my daughter turned 21. And yeah, sure enough, now that she's 21, immediately, well, you are going to be in the adult section. And I think what I observed was like the room itself, right? It was just scary. We're not used to adult hospital rooms or ER areas. So I think that just was a shock for ourselves. Seeing everyone around her, adults, all different ages, when we're used to seeing, much younger population. So I think just that alone itself was a little bit of like, it was different, and it's like, it kind of starts setting in that, look, what, things have changed. We have to transition, we have to adjust, we have to adapt, right? But I think one of the things for us is that if you have a child with special needs, the importance of having that guardianship paperwork all sorted out when they turn 18, and then making sure your insurance companies, right, have that as well, have those certificates, because they're an adult, and if they don't have it, or like, we make decisions for our daughter, but if they don't have that certificate, we're not really allowed to speak and advocate for her. They need to see that we have the legal authority. So just something as a tip for other parents whose kids, are coming of age, that, that guardianship paper and certificate is very important, and getting it over to the right, to your insurance company is critical as well.
Yeah, we always thought we had until my son was 21 to make some of these big decisions on his health insurance and care and stuff. But we found out that it actually has to be 6 months before his 21st birthday to make switches, like in the Medicaid. If you have a home and community-based service waiver, you have to decide kind of beforehand where he's going to go at 21 so that they can get ready for it. So we had to jump in and try to determine if we were going to keep his Medicaid waiver or if he was going to go to a long-term care plan. And I think a lot of that varies by state how that works, but we ultimately, in order to keep home nursing, had to decide to go with a long-term care plan to keep our nursing agency with us.
Yeah, Jeff, it's like a different language, a vocabulary that kicks in, right? And trying to educate yourself, and in the end, you want to do what's the right thing for the best care that you can provide for your young adult, yeah, your child adult. So, yeah, it is hard, and I think I go back to it, having that village, that network is critical. I cannot emphasize that enough. That people, trusted sources that you can go to seek advice, ask questions.
Yeah, it is. And just a little bit more about what I had said is, we bend over backwards to get our home and community-based service waiver for my son. The only reason we ended up being able to kind of break the wait list, which in Florida is years and years long, in order to get that. My wife had breast cancer, and because of her breast cancer, she could no longer be the primary caregiver for a time of my son while she was going through that journey. So we got moved to the top of the wait list and got our waiver in order to help find support for him while she was going through her health issues. So when all of a sudden somebody comes to you and says, you're going to have to give up your waiver in order to keep your nursing for your son after he turns 21, you can imagine the feelings we had there of, no, how are we? I mean, we fought and fought and fought for this, but at some point you just have to understand that things change, like you said, and like Vic said at the beginning of the show, things evolve, and that's what happened. I mean, and because the payout rates for the Medicaid are smaller than the payouts for the long-term care plan, a lot of the home nursing agencies won't take Medicaid pay rates for their patients. So because that is our primary need, is someone to help my wife with our son during the day while I'm working, we had to make that the primary choice we made moving forward. So now he will continue to have home nursing after 21 through a long-term care plan. But that's just it. I mean, it varies from state to state. It all depends on, I think a lot of it might go back to Obamacare and the expansion of Medicaid. In many states, our state didn't take that Medicaid expansion, so things stayed pretty dismal in the Medicaid world in Florida. So now we are having to deal with that and see how we're going to move forward as we face this big change at 21.
And Jeff, I'm so glad you mentioned home and community-based services. And as you alluded to, these vary widely from state to state. They're most of the time they are connected to Medicaid. So my next question to you both is, how is current policy impacting your ability to get caregiving support for your young adult children? Because this has got to be an interesting issue right now.
I think it's through these conversations, MaryAnne, that we move the needle. There are many organizations, foundations, hospitals that are trying to figure this out. Everyone has good intent, and I always think about how there are probably hundreds of organizations trying to figure this out, right? So, if there are opportunities for these organizations to come together, would be ideal, or a few of them to kind of do it together, right? And instead of each one trying to reinvent the wheel on their own. But I think it's through these conversations, communications that we move the needle. Look, we're seeing it move, right? I mean, this whole thing about being able to self-manage a budget 20, 30 years ago, though that was just like a conversation, discussion, wouldn't it be wonderful? But it's happening. It's taken time, but it's happening, right? So I think it's just we need to continue these conversations and see where the gaps are, and then how do we pragmatically close those gaps?
Absolutely. It's just going to continue. It's going to continue to evolve moving forward. And it's really something that you have to stay on top of, because things can change, with legislation. I know prior to recording this podcast, we were talking with MaryAnne about the executive orders that came out for caregivers and things like that. And nobody's even been able yet to really read through that and know what implications that's going to have on us moving forward. It takes a lot of research and a lot of time to get that done. And when we were coming into this, making that decision on whether to keep our waiver or go with the long-term care plan, my wife was like calling people like, who can even tell me what the differences are between these? And no one person had all the answers. They were telling my wife to talk to Department of Elder Affairs and telling her to call the Medicaid office and talk to your waiver support coordinator or reach out to the insurance company that offers the long-term care plan. But even talking to each one of those, they didn't know what the other one had on it. So nobody could give her true advice on what decision to make. And it finally, she literally had to sit down and put on paper, this is what this has, this is what this has. And we had to sit down like over several days to make the decision as to where we were going to go. So it just isn't easy.
I'm listening, Jeff, and I'm just saying yes, yes, yes. We have very similar journeys, right? Look, caregiving, let's face it, especially for someone with a chronic condition, with a disability like we're talking about, it's 24/7, right? There are no weekends off, there's no holidays, it's 24/7, right, for us. I think for my wife and I, it's been hard. How do you balance work, home, life, and while at the same time give this care, additional care that's required? We've had to be very agile, very flexible, adaptable, and change. I think that's how we've been able to manage our professional careers, both my wife and I. But then I would say just the care coordination, care management, care coordination is a job in itself, right? I give all the credit to my wife, who has been able to figure this out. But obviously, it takes emotional, physical toll on you. We're all getting older, and those are the things, right? So I'm just kind of thinking about, as our kids transition from the school system to the outside world. They actually had this self-contained world where a lot of the services were just taken care of in the school. Now, all of a sudden, right, we have to take on even more responsibility, because those services, when they leave school, they stay in many places. They stop. Luckily, in the town we live in, the community we live in, they can continue at my daughter's school, which we're thrilled about. But that's the reality that most parents face, right? That you have to figure this out. So you transition from schools to day programs, and which really don't have the protection that a K to 12 educational system has, right? Um, and so it's a brand new world out there where I always say that our daughters goes to a school which is so trusted, so safe, and we're going on to this world which we now it's unknown. I'm not saying it's not going to be safe, it's not going to be trusted, but it's unknown for us, right? So finding that the right programs requires a lot of due diligence and research. And I would tell parents as their kids are getting older, getting to that 21 age, right, where they're going to become adult and transition from school to the outside world, start that research early as you can and do your homework. And so this way you're set up for success.
2 points on that. Even when you do sit down and you start asking people questions like, is long-term care going to cover physical therapy for my son? They may say, yeah, we cover physical therapy. But then does that mean you're going to cover physical therapy like it was when he was a kid and he's going to have it forever? Or does that mean that he's going to have it for 6 visits after each hospitalization? Because, I mean, even though they say they cover physical therapy, it doesn't mean they're going to cover physical therapy like he's had physical therapy covered. And beyond that, you can't even look at what he's had because what he has isn't going to be the same anymore because he's moving from children's to adult. So you can't even, you can't stay where you are and you don't know where to go.
And Jeff, kudos to you and your wife for advocating for your son, right? And I think, my understanding, right, just based on the conversation we had, Jeff, is that, just the difference between New Jersey and Florida, right? It's stark. But even for us, right, like, it's a new world, and figuring out how you cover nursing, what's covered, what's not covered, what are the different options what are the different plans. And, in our family, my wife and I, we speak English, we're educated, my wife has a legal background, and even with all the resources that we have and a network that we have, it's been hard. Because trying to decipher, the government talk and speak into something that's understandable, and there's always some conflicting information you hear. It is hard. So for us, when I hear about the differences that exist between state to state, which have Obamacare, which do not, I think that makes a big difference. One nice thing about New Jersey is that when your child turns 21, there is a self-directed model, where the caregivers have a little bit of say in how the child's budget care is administered. So I think it's taken many decades of learnings that went into that, but we're really glad that that parents or caregivers are have a voice now, which they may not have had years ago.
Just listening to this conversation, it really illustrates the challenges faced when we have 50 states, the district, and 5 territories who have different interpretations and implementations of Medicaid. And by the way, the challenges faced by families in those states that chose not to expand Medicaid. This is really what I want our listeners to absorb. These are real world examples. There's a stark contrast between what Vic is experiencing in New Jersey. And my understanding, Vic, New Jersey did expand Medicaid with Obamacare, and yet Jeff in Florida is experiencing what happens when states choose not to do that. So again, real world consequences to some of the decisions made in our state houses. I would like to ask both of you, how has your quality of life as a caregiver been impacted by the challenges you face in getting care and support for your child? Because none of this happens in a vacuum. As caregivers, you are on the front lines day in and day out. How has this impacted your quality of life?
It's totally changed my life. and my wife's life. My wife was an electrical engineer before my son was born. And when he was born, she gave up all that and became his primary caregiver. I continued to work. My background is in television. I worked at the NBC station here in Orlando for many years before moving to the hospital, and never dreamed I would work at a hospital. But with everything that happened with my son and the care that I was lucky enough to have for him through the system that I work for now, really just changed my whole perspective on life and what's important. And, I was happily amazed at the path that I was led down with the hospital that brought him into this world. They embraced us as a family. They allowed us to make the decisions when we didn't expect things to go well, and just stood by us and really said, we are here for whatever you want to do, and whatever happens, we will support you through it. And led us right from that into the pediatric care for him. They have a family advisory council that formed back in 2010 that I was lucky enough to chair for 3 years while he was growing up. And during that time, they said, we want to bring a parent on staff so that we can continue to recognize family-centered care as the best way to run a pediatric hospital. So I got to take on that role and have enjoyed every minute of it since then. It's hard though, and my wife, it has changed her world. She is a stay-at-home mom, like I said, and going through all this is probably the hardest time she has ever had with him, facing all these monumental changes to everything that was her foundation for 20 years with him. She could count on this. She knew everything she needed to know about Medicaid and about the waiver and who to call and who to contact. And care for kids is so safe and sound, really. It's there, and nobody challenges what you want to do with a child when it comes to therapy. If you want your child to have physical therapy 3 times a week, nobody's going to question that. If you want them to have occupational therapy, nobody's going to question that. Speech, it's all right there for you. But this change to being an adult, it all goes out the window. It's like everything now has to be, well, why does he still need that? He's an adult now. A lot of things you could get through schools too. And now that he's going to be 21, that's no longer an option. So it has been a very stressful time for her. And to the point where, she's looked at me and she has been at wit's end with how am I going to continue being as successful with him facing all these new challenges. And on top of that, we've had challenges with her parents getting older. So now she's having to jump in and not only take care of our son, but take care of her parents as they, get older. So it's been a lot to take on at once, and it's not getting any easier, and it probably won't, because he is, like we said earlier, medicine is evolving and these kids are lasting longer or living longer, but it still takes its toll. These diagnoses take their toll on them, and as they get bigger and more challenging to move, and you need additional help just to turn your patient over or move them from bed to wheelchair to couch, all that takes a toll on your physical self too. So I'm sure Vic is familiar with all this as well.
Yeah, and Jeff, we went through something similar as well. Basically, it's like, you have all these dots, data points, some information, and you have to connect those dots. And because each child's, or as they're transitioning, they have different disabilities, different needs. So it's like, that one size fit all approach doesn't work for us. So how do we now put together a cobble up or hobble up that plan that works best for us, right? So that my advice to, parents would be that, that you do have to invest that time. You have to, you won't get it right the first time as you're kind of putting that plan together, but through several iterations, it'll emerge, right? And it'll become very clear. And once you have made that decision, which path you're going, which road you're going to go on, you move forward with that, and then you adjust, right, based on what that service is, what that care is, because expect that it will change and it'll need to change.
I think ideally, we can all agree that a successful journey for any of us in life, our health, the health care that we receive is a partnership, right, between patient, caregivers, and the health system, right, a very important partnership. If these health systems actually worked with you to co-create a better process, what would a successful transition from pediatric to adult care even look like?
Well, we are working on that. That has been really, I told you earlier that we had a family advisory council for our children's hospital that I was lucky enough to be a part of and still am today. Now that I'm on staff, I'm overseeing the council, and actually have expanded to where we have 5 councils now at our children's hospital, focused on different areas. But all of them are very dedicated and have decided that the major issue that they want to tackle over the next several years is transitional care. And we have been working with our leadership at our children's hospital to develop different ways to move our patients through the system that prepare our families and patients for that. Even, we're kind of formulating our wish list right now, but we're lucky enough that for our most complex patients, we have what's called a coordinated care for kids program that has been working with families throughout these kids' lives to help them through, these getting orders that they need for home health care, or getting paperwork needed for school, or insurance issues, or durable medical equipment authorizations, anything like that. That will be handled by that program. So as we sit down and say our kids are getting older and they're moving into the adult world, we are hoping to replicate that program, like as a coordinated care for adult program that would basically do the same thing, because these kids are still here. And even sitting in on some of these initial meetings we've had, there is great desire among the hospital staff to do this the right way. I mean, any patient that you've taken care of for 21 years, the last thing you want to do is let go of them, send them off to another hospital, and never hear about them again. We have relationships with these families. We have brought kids from the brink back and witnessed recovery, and that is just an amazing thing. So we are committed and dedicated to the lives of these kids. And sitting in some of these meetings with even the physicians, they're like, I want these kids to succeed. I want to hand them off to somebody that I trust is going to do everything they can to take them to the next level. So coming up with that program and finding the right people to run it is gotten us to a place where we are bringing aboard every specialty, including the parent voice, to help us figure this out in the right way that's going to really prepare families from mid-teens right through that 18 to 21, depending on, the type of patient we're talking about when they would transition. But even to the point of if it is a child who's going to go to college or going to go, to the career world, that they are prepared to take over their own care if they can. It's like walking them through those last couple years of like 16, 17 into 18 of, okay, you're going to be the one that's going to make your next appointment. You're going to be the one that's going to call the pharmacy and get your refill and know what you need to do. Or here, you need to make a phone call to the insurance agency because the insurance is questioning something. So here's the bill and here's who you're going to call. I mean, really patterning that through the kids so that when they do turn 18 and go to college or go to the next part of their life, that they know exactly what they need to do. And for those kids like Vix and my child who aren't going to be able to do that on their own, partnering with the parent to like, okay, here is that list of specialists that will see your child. You know, this is who we found works well with these kids. Or when next time you come into the hospital, you're going to go to the adult ED, but we've taken a part of the adult ED and we have made it similar to the peds ED, where parents like you can be in the room with your child and stay overnight. Talking to many of the parents that have done this before me and seeing them in the hospital, one of the major things they say is there's nowhere in this room for me to stay with my child. There's nowhere for me to sleep. There's nobody who will walk in the room if I need to walk down to the cafeteria to get a coffee or something and can't leave my child alone. I need somebody that's going to sit in that room until I get back. So really trying to take those issues and work them out and finding a part of the adult ED to put these patients in, or finding a part of the adult hospital to make a special unit that is similar to the peds in the size of the room and a place for the parent to sleep, is all things that we would like to be able to accomplish moving forward.
You know, and Jeff, to that, what I'll add is that, right, so now that, yes, you have some coverage, you try to find the provider. You know, in our state, one of the challenges, of course, the reimbursement rates are not accepted by many private practitioners. And then finding people as well, because they themselves are busy. Right. So yeah, you have a service. It looks good on paper, but on practicality, it's much harder to implement. Right. But you know, the kind of the glass half empty, glass half full. Right. Looking from that positive side is that there are ways, but you have to do a lot of digging and searching.
Gentlemen, let me ask you this from your standpoint. How can we move the needle on this issue? I'm hearing about pockets of success. How do we take that and translate that nationwide? What is it going to take? Advocacy? Education? What is it that we can do collectively to help?
Fortunately, there is a roadmap for this, and we've really looking very carefully through it. But the government, the federal government, has put together what's called Got Transition, and I think if you Google that term, you'll end up at their website that really lays out all of the steps that need to be taken to transition pediatric patients into the adult world. So starting there is a great place to start for help. The American Academy of Pediatrics has also published a report on transition that goes all the way to like age by age breakdown, like we were talking earlier with like transitioning patient that's going to care for themselves, you know, and what happens at 14, what happens at 16, what happens at 18, to prepare them to take on their own care. And then there's like letters that the pediatric doctor's office should be giving patients at 16 to say, you know, in 2 years you're going to be transitioning to an adult and this is how things are going to change. And then for adult care providers to send to a new patient that says, okay, you are 18 now and this is what we do at our office and what you should expect. So people have thought about it. It's just really getting it from those theoretical states into major health systems to realize that you can't ignore this issue anymore, that these patients are coming down the pike and more of them are going to be facing these dilemmas, and it's not safe to not prepare for it. There are there are too many instances where adult pediatric patients, I know we've had trouble trying to term this, but our adult kiddos have been left, in rooms by themselves with no caregiver or provider, and then something can happen because they're alone and they don't know what they're doing to themselves. Or, they can pull out a central line or something like that. And nobody be in that room because they're an adult and they don't put somebody in a room with an adult. So it's recognizing that these cannot be seen as a typical adult patient, and special needs need to be taken to protect them. And I think if we use those resources that are out there, that it shouldn't be too hard to at least begin a pilot program or whatever to take on these issues.
Well, I got to tell you, I have learned a lot from today's discussion. I'm sure our listeners have too, and I want to thank both of you for sharing your family stories so openly with us. For my listeners, we really need to ensure that our healthcare system is meeting the needs of everyone, including these young adult kiddos in the special needs community. This is a gaping hole that needs to be fixed. And what can you do? Well, let's educate your friends, family, and colleagues now that you have a better understanding of the issue. Until next time, we'll see you again on Us Versus Them. Take care.